So now we shall discuss regarding the leg muscles, okay? So we shall discuss regarding the muscles of the leg. So when it comes to the muscles of the leg, the first important thing is, first of all, let us make a section of the leg muscles, and then we shall see what are the nerves compartments we have. Then we shall write down the list of the leg muscles, okay? So first important thing is, when I am taking a section of the leg, the outermost layer whatever I find, so this is the outermost layer. So this outermost layer whatever I find is called as your skin. All of you know this, okay? And just beneath your skin you have got a fascia like this. So what is a fascia that is located just beneath your skin, guys? So this fascia which is located just beneath your skin is called as superficial fascia, okay? So this fascia over here is called as your superficial fascia. And just beneath your superficial fascia you have got another fascia over here, if you can see, right? So this fascia over here is called as a deep fascia. So we have got something called as superficial fascia, okay? And next we have got something called as a deep fascia. Deep fascia, okay? Let us say that this is the anterior side and this is the posterior side. Now only thing is we have to know which is the medial and which is the lateral side. And in the leg you have got two bones. What are the two bones? So one bone you have got is tibia. So this is your tibia bone. This is your tibia bone. And next important bone which you have is your fibula. So this is your fibula bone. And in between tibia and fibula you have got a membrane, and this membrane is called as interosseous membrane, okay? So always remember that wherever there is fibula, that is a lateral side. So which means this will be your lateral side and this will be your medial side, okay? Now you know that deep fascia here, deep fascia is the one which will divide the leg into compartments, okay? For example, you see deep fascia is attaching to the fibula here, deep fascia is attaching to the fibula, right? And next important thing is deep fascia is also attaching in this way. So here the deep fascia has divided the entire leg into three compartments, okay? So this is called as an anterior compartment, this is called as a posterior compartment, and this is called as the lateral compartment, okay? So we don't have a medial compartment in the leg. We don't have a medial compartment in the leg. In the same way in the thigh we don't have a lateral compartment, we have medial compartment. So in the leg we don't have medial compartment, we have a lateral compartment here, okay? So this is the complete picture here. Now in this picture three important things you can see, right? So you can appreciate that there is a septa, this septa which you can see, this septa is dividing into compartments. So it is dividing the muscles of anterior compartment from lateral compartment, yes or no? And this septa is looking anteriorly. So that is why this septa is called as anterior intermuscular septa. Anterior intermuscular septa. So anterior intermuscular septa, right? Anyways, so posterior compartment, if you see, posterior compartment is divided into again two. You see this? This compartment over here is called as posterior superficial compartment. Posterior superficial. So posterior superficial compartment, and this is called as posterior deep compartment. Posterior deep compartment, okay? Now let us see what are the arteries, nerves as well as vessels that are located in the anterior compartment. Muscle names I will write it later on, and later on if I pick up one muscle from anterior compartment and I ask what is the artery, what is the vein, you should tell the name, okay? So anterior compartment is having an artery, right? It is also having a vein and it is also having a nerve, okay? So what is the name of the artery that is located here? Yes, what is the name of the artery which we have? The name of the artery is called as anterior tibial artery. ATA stands for anterior tibial artery. And what is the vein here? Obviously anterior tibial vein. ATV stands for anterior tibial vein. And the nerve here stands for DPN. DPN matlab deep peroneal nerve, right? I hope you are writing it down. DPN is deep peroneal nerve. ATA is anterior tibial artery, ATV is anterior tibial vein, and DPN is deep peroneal nerve, okay? So here ATA is anterior tibial artery, ATV is anterior tibial vein, and DPN is deep peroneal nerve. Sorry, not artery, deep peroneal nerve. Okay, so these are the three important things which you can see here. Okay, right. So these are the three important things. Now, apart from these three important things, another important thing which you can see here is that on the posterior side, all the structures which you have will be the posterior. So here you have got an artery, okay, and you have got a vein. Apart from that, you again have got an artery, you have got a vein, right, and you have also got a nerve. Okay, so what is the name of the artery that is located here? The name of the artery which is located is peroneal artery. This artery is called as peroneal artery, and name of the vein is peroneal vein. Okay, when it comes to these three, right, so here it is anterior tibial artery. So if it is anterior tibial artery, here it will be posterior tibial artery. Okay, here if it is anterior tibial vein, here it will be posterior tibial vein. Okay, here if it is deep peroneal nerve, here it will be tibial nerve, tibial nerve. Okay, so let me write down again these three structures. So posterior tibial artery, posterior tibial vein, you know. So TN stands for tibial nerve. TN here stands for tibial nerve. And in the same way, peroneal artery, peroneal vein. So these two structures are peroneal structures, peroneal artery as well as vein, right? Now look what is going to happen. So within the lateral compartment, you have got only one important thing, that is nerve, and that nerve is SPN. SPN matlab superficial peroneal nerve. Okay, SPN stands for superficial peroneal nerve. Superficial peroneal nerve. Okay, so here important things to know, that lateral compartment is not having an artery, it is not having a vein. Then how are the muscles of lateral compartment surviving? How are the muscles surviving is that this peroneal artery itself will supply the lateral compartment, and in the same way this peroneal vein itself give innervation to the lateral compartment. So lateral compartment by itself, it is having only superficial peroneal nerve, but the arterial and venous supply is coming right from the posterior deep compartment, right? And next important thing is, then what about the posterior superficial compartment? Posterior superficial compartment is not having any neurovascular bundle, neurovascular structures. There is no artery, there is no vein, there is no nerve. Then how are they getting supplied? How are they getting supplied is that the posterior tibial artery gives a branch like this, posterior tibial vein gives a branch like this, and tibial nerve here gives a branch like this. Okay, so the only compartment in the entire body which is lacking neurovascular bundles, neurovascular structures, is a posterior superficial compartment of leg. Okay, so it is not having any neurovascular structures by itself. So posterior superficial compartment of leg is the only thing that is having no NVB, neurovascular bundle or neurovascular structures. Okay, so this is the overall thing you need to remember. Now adding up on this, for example, if I tell what are the muscles, for example, if I tell a muscle, pick up a muscle in the posterior compartment and I ask you what is the nerve supply, you should tell it. If I ask what is the artery supply also, you should tell it. So this is a pretty easy picture. Now if you just learn the muscles, then you can apply all these things on that. Okay, but anyways, so what are the three compartments we have got? Once again, we have got anterior compartment, right? We have got lateral compartment, anterior compartment, lateral compartment, and next we are getting posterior compartment, right? So in the anterior compartment, if you see, what are anterior compartment muscles responsible for? For example, see, this is the leg over here, right? This is the leg. Now in this leg, this is the foot. These muscles in the anterior side are called anterior compartment. For example, when I'm pulling these muscles, what is happening? My foot is elevated like this. You're getting it? So my foot is flexed onto the dorsal side. So this kind of flexion is called as dorsiflexion. right? So what is happening in the, with the help of anterior group muscles, there is dorsiflexion. So all these are dorsiflexors. And next important thing is lateral. Lateral matlab see, this is the lateral. So when these muscles contract, what is happening? My foot is elevating like this, right? So it is levated in this way. So these are called as everters. And finally, the posterior compartment. Posterior compartment is the muscles that are located here. When they are contracted, my foot depresses down like this. So this is called plantar flexion. Anterior is called dorsal flexion. Now you should call it as plantar flexion because my foot is flexing onto the plantar side. Okay, so this is a plantar flexion. Plantar flexion or plantar flexors. Plantar flexors. So these are the three important things which you need to know.